Good afternoon, everybody. Thank you very much for joining us again today. I'll start with the usual update on today's statistics. The total number of positive cases reported yesterday was 966. That represents 4.2% of the total number of tests and takes the total number of confirmed cases in Scotland to 98,686. 258 of the new cases were in Greater Glasgow and Clyde, 166 in Lanarkshire and 117 in Lothian. The remaining cases were spread across the other mainland health board areas. I can also confirm that 965 people are currently in hospital. That is a decrease of 17 from yesterday. 65 people are in intensive care, which is 4 less than yesterday. And finally, sadly, 41 additional deaths have been registered in the past 24 hours of a patient who first tested positive over the previous 28 days. That takes the total number of deaths under this measurement to 3,889. Each one of those deaths was, of course, of a unique individual whose loss is a source of grief, and I extend my condolences to all those who have lost a loved one during this pandemic. I'm joined today by Professor Jason Leitch, our National Clinical Director, who will help me in answering questions from journalists shortly. Before that, there are 3 main items I would like to update you on today. The first concerns international travel. Very often on a Friday, we provide an update on the quarantine exemption list. Following our usual risk assessments, I can confirm that the Scottish Government has not made any change to that list this week. As you may be aware, the UK Government last night announced a number of changes to the quarantine rules in England. Those changes exempt certain categories of people working in certain sectors from the requirement to self-isolate. I want to emphasise that these are changes that apply only in England and that they do not apply here in Scotland. The quarantine requirements in this country are unchanged. Anyone travelling to Scotland from a place that is not on the exemption list will be required to self-isolate for 14 days upon their return. The Scottish Government will assess the need for any further sectoral exemptions at our next review of the international travel regulations, which is to be completed by the 14th of December. And as we do that, we will of course need to consider very carefully the impact on public health. In general, of course, our advice in relation to international travel remains the same. The Scottish Government is continuing to advise very strongly against any unnecessary travel overseas right now. My second update for today concerns additional support for the childcare sector. The Scottish Government has today announced the extension of our rates relief scheme for nurseries. The scheme provides full non-domestic rates relief for premises that are used entirely or primarily as day nurseries. And this year alone, it is estimated to have saved eligible nurseries an average of £12,000. The rates relief scheme was due to expire in March. Today, we've announced that we are extending it for a further 2 years, until June 2023. We hope this helps to ensure that childcare can remain as affordable as possible. Day nurseries, like so many businesses, have faced continuing financial pressures as a result of the pandemic. However, they play a critical part in supporting the learning and the development of young children, and they will also be especially important as our economy recovers from the crisis in allowing parents and carers to work, study, and to learn new skills. So my hope is that today's announcement, by providing further certainty for the sector, will be good news for day nurseries in particular, and also good news for families across the country. The third and final item I want to cover today relates to the good news that we've heard this week about a vaccine. Specifically, I want to reiterate some of the points about our vaccine implementation plan. As the First Minister stated earlier this week, we expect the first vaccine deliveries very soon, which will allow vaccinations to begin on Tuesday of next week. Obviously, we will start by vaccinating those who will be vaccinating everybody else. We will then follow the independent advice that we have received from the Joint Committee on Vaccination and Immunisation. They have recommended prioritising those with the greatest clinical need, specifically frontline health workers, residents and workers in care homes for older people, and people over the age of 80. So these will be the first groups to receive the vaccine. With regard to the Pfizer vaccine, there are conditions attached to its authorisation which make it difficult to transport to some locations, such as care homes. We are in the process of planning how that can be done safely and effectively, and we plan for the vaccine to start reaching care homes from the 14th of December. Provided that the volume of vaccines being delivered allows, and this will be influenced by other vaccines gaining supply approval like Pfizer's, we aim to have the first phase of the vaccination programme completed by spring. Clearly, if there are delays in supplies which will impact our timings, but we will move as swiftly and as flexibly as vaccine supplies allow. The Joint Committee sets out a clear order of priority for vaccine delivery, and we will follow that as much as it is practical. The priority list they identified represents around 99% of preventable mortality from COVID-19. Once the vaccination of these groups is completed, we will seek to vaccinate the rest of the adult population, as while the risk of mortality is much lower in people under the age of 50, there is still a serious risk of debilitating illness. The very fact that vaccinations in Scotland are scheduled to start in 4 days' time is fantastic news, and for all of us, it brings real hope that an end to the pandemic is in sight. However, the end is not here yet, and it won't be for some time. And so for the moment, the fact that vaccination is now a real prospect should encourage all of us to do everything that we can to keep ourselves and our loved ones safe. The best way of doing that, as ever, is to stick to the current rules and guidelines. So I will end as usual by highlighting some of the key points from those guidelines. If you're in any doubt about what those rules are in your local authority area, you can of course use the postcode checker on the Scottish Government's website. However, nobody outside of Orkney, Shetland and the Western Isles should be visiting each other's homes except for very specific purposes such as childcare. If you do meet people from other households, either outdoors or in public indoor places, the limit is 6 people from a maximum of 2 households. In addition, avoid car sharing if you can. Work from home if you can. As we move into winter and the weather worsens, there's all the more reason to do that. Download the Protect Scotland app if you are able to do so. And finally, remember facts, the 5 key rules that we all can use to reduce our risk of getting the virus or of passing it on. Face coverings, avoid crowded places, clean your hands and clean hard surfaces, keep 2 metres distance from people from other households, and self-isolate and get tested immediately if you have any of the symptoms of COVID. By sticking to these rules, we can protect ourselves, our loved ones and our communities. We will also protect our National Health Service and we can save lives. So thank you once again for all that you're doing in this national effort. And I now turn to answering questions from journalists along with Professor Jason Leitch. And the first question is from Ross Govins of STV. Ross.
Afternoon, Deputy First Minister. You've told us that care home residents will start receiving the vaccine from the 14th of this month. I wondered a bit about the plans, if they've been finalised for homes in the more rural communities in Scotland, including the country's islands. And a quick one for Professor Leitch as well. The First Minister said earlier in the week you were watching closely the levels in Aberdeen City and Aberdeenshire. What's the latest data telling you, and is there a likely that COVID restrictions could be increased at the start of next week?
Thanks very much, Ross. Let me say a little bit about both of your questions. I'll come on to invite Jason Leitch to say, Jason Leitch actually may say something about both as well. We are taking forward the delivery plans on the vaccine very urgently, and as I've set out today, we will start the first vaccinations of the vaccinators on Tuesday, and we will be delivering vaccines into care homes from the 14th of December. Now, clearly, we want to make sure that all parts of the country are able to, the priority groups are able to gain access to the vaccine. So we're looking at a number of practical steps to make sure that we can get that vaccine to all of the island communities, because there will be members of the population in those island communities who will be eligible for the early phases of the vaccination. Now, there are a number of practical issues that we have to work through about the handling of the Pfizer vaccine, which will be the first vaccine that's available, and we're working very closely with health boards to make sure that we can deliver those supplies to individual island health board authorities, and we'll set out further detail on that whenever that work is completed. Secondly, on the levels work, and particularly about decisions around Aberdeen City and Aberdeenshire, we are monitoring those cases very closely. The data indicates that there is a greater problem in Aberdeenshire rather than in Aberdeen City. But what we're exploring very closely, and we asked for further work to be undertaken on this yesterday, is to try to identify the degree to which individual outbreaks in, for example, meat or fish processing factories, of which there are a number of these outbreaks in the Aberdeenshire area, the extent to which they are inflating the position within the Aberdeenshire area, and the extent to which that is then flowing into community transmission. Because while we may be able to take decisions based on individual outbreaks, we have to be satisfied that community transmission is not a significant threat. And it's those very careful elements of interrogating of the data that we're undertaking just now. There is, of course, going to be a review of the levels data announced by the First Minister in Parliament on Tuesday. The work for that is underway just now, and I'll be involved in dialogue along with the Community Secretary, Aileen Campbell, with a range of local authorities on these questions over the weekend. Jason.
Thank you, Deputy First Minister. So the answer to your first question, Ross, is of course this is hugely complex. We're trying to align three things here, if you think about the vaccine programme. Those who need it, the JCVI give us that list. So that's the list the Deputy First Minister just read out, the over 80s, the care homes and the health and social care workers. So that's bubble number one. Bubble number two is the amount of vaccine we have. So if we get 10 million doses versus 2,000 doses, we have to make choices within that. And then the third thing is the logistics of the particular vaccine that is being delivered. And that will change over time. All three of those things will change over time. So we have to align them as best we can to not waste any vaccine and get it to the people who need it. This vaccine gives us particular challenges, as you've seen in the news and from this briefing, around the nature of its transportation, the fact it comes in large pallets, and it needs to be frozen at -70. So that means you can't do as much with it as you would like. So therefore we have to compromise and get it to the places where we can distribute it. We also are not absolutely sure how many Pfizer can give us. We know how many are coming this week, but we don't know how many are coming in January. So in consultation with the company, with the UK government, with the devolved administrations, we have to align all those three things to get the vaccine to the people in that list who need it. And that's exactly what hundreds of people across Scotland are doing even today as we plan for that. Aberdeen City and Aberdeenshire the headlines are exactly as Mr Swinney described. Aberdeen City is a little bit of a mixed picture, I think I would call it. So, for example, if you just look at the last week of data, the number of cases is down 29%, but has increased in 4 of the 7 days. So it's very important to look over time at the prevalence of this virus. In terms of the test positivity, it has decreased from 5 to 3.7. So that is good news. But it is not universal good news in Aberdeen City. In Aberdeenshire, I'm afraid it's not such a mixed picture. Everything is up. Case level is 21% up in the last 7 days, and there have been increases in 6 of the last 7 days. And test positivity has gone in the opposite direction. It has gone up to 5.2% from 4.3%. They're not the only things we consider. We have to absolutely look with the Directors of Public Health about outbreaks, about the capacity of NHS Grampian, about other things that are happening in the local authority and the surrounding areas. And that will happen even today. We're having a conversation with the Director of Public Health, and those conversations will continue with the local authorities with our support and advice over the weekend.
Thanks, Jason. We'll move on to David Henderson of BBC Scotland. David.
Thanks very much, Deputy First Minister. I'd like to ask about education. The UK government has said the main schools exams can take place in England next summer, while here, Nat 5s have been cancelled, and you've said you won't make a final decision until February on what's happening with hires and advanced hires. So if England can hold a full exam diet with safeguards, why can't Scotland? And is offering the vaccine for teachers being considered to make it as safe as possible?
Thanks, David. What we've, as you correctly narrate, we have already cancelled the National 5 exams, and I decided to do that because I thought it was a sensible move to make to ensure the ability of young people to concentrate on their learning and teaching along with their teachers over the course of this year, and to assess them through the continuous performance of young people during the year. Because by removing the National 5 diet, we remove about 60% of the exams, and we don't yet know what the circumstances are going to be in the spring of next year when the exam diet would be scheduled to take place. And it also enabled us to delay the start of the higher and the advanced higher diet by a number of weeks, to give more opportunities for learning and teaching time to catch up on the detail that we have on the volume of time that's been lost already. Now, in relation to the hires and the advanced hires, there's a couple of things I'd want to say about that. The first is that you're correct that I've said the last moment we can essentially change our plans would be the February break. But I think I would be keen to take an earlier decision if it is required to be taken to give certainty to the education system. And the second point is that any decision that will be taken on that question is now firmly in my mind to be taken on one question and one question alone. And that is about whether we can be satisfied that the level of disruption that has taken place in the education of individual young people who would be sitting hires and advanced hires gives those young people an equal chance to be able to perform well in the sitting of exams in the spring. And if there is an equity issue there, because for some young people, they will have had no disruption to their year of education through self-isolation, but for some young people, they may have had disruption, and in some circumstances, they might have had multiple disruption to their education because of the requirement to self-isolate. And I have to be satisfied that every young person who is supposed to be sitting a higher or advanced higher exam in the spring is able to have an equal chance to shine and to prosper in that exam. So that's the question that I'm exploring now. I'm gathering data from local authorities about the extent to which the education of young people is being disrupted in that fashion, and we obviously will come to conclusions on that at the earliest possible opportunity to make sure that young people have got a fair and equal chance to take forward their education this year. And we'll set out further details on that whenever we come to those conclusions. Okay, if I can move on now to... Oh, sorry, thank you. Vaccine for teachers. What we've got to do with the vaccine is we've got to follow I think it's advisable for us to follow the prioritisation list that is set out by the Joint Committee on Vaccine and Immunisation. And that's the one that was set out this week, and we have accepted that, and we will work our way through that. Now, obviously, the sectoral information that is in that priority list prioritises health and social care workers to make sure that they can be supported with early immunisation given their proximity to the acute threat of COVID. But what we will be working to do in the wider activity that we take forward is to put in place the testing regimes for teachers. There are already testing regimes available for teachers as we speak. There'll be further measures in relation to testing being rolled out after the Christmas holidays. And that will be part of the suite of measures that we take forward to make sure the teaching profession are as well supported as they possibly can be in the delivery of education to children and young people in our schools across Scotland. Right, we'll move on to Alan Smith now from Bauer. Alan.
Thank you, Deputy First Minister. The Scottish Parliament's corporate body has decided this morning that while we're in a public health crisis with devastating economic consequences, there shouldn't be a pay rise for MSPs next year. I just wondered if that's a decision you would welcome. And one for the National Clinical Director. We're seeing renewed calls today to allow gyms to reopen in level 4 areas, given their impact on physical and mental health, and particularly on days like today when it's much harder for many people in many areas to exercise outdoors. Can you envisage a situation where gyms could reopen in level 4 areas? And on the evidence of transmission within gyms, you've previously explained why they pose a risk, but is it possible to publish more data specifically on gyms, rather than the exercise as a whole, but specifically on gyms?
Thanks very much, Alan. On the decision of the Parliamentary Corporate Body, this is a decision that I welcome. I think it's absolutely the right decision to have taken, I think it's correct in these circumstances. The pay of ministers, of course, has been frozen at 2008-9 levels, so that's been frozen for some considerable time, but I unreservedly welcome the decision that Parliament's taken today. And I'll pass over to Jason Leitch on gyms.
So the important thing about, two important things about level 4. Remember, level 4 is to be used in exception to drive down prevalence, so has to be fairly severe. And I don't need to tell that to the 2.5 million people who are living under that level just now, including me, and the businesses inside those level 4 areas. The First Minister has been very clear that level 4, as presently designed and as presently happening across Scotland, will finish on the 11th of December. At that point, we will announce which levels those local authorities will go into. At level 3, gyms are allowed to be open for individual personal exercise. I think that's the right level for gyms to be at. They are not risk-free. Unfortunately, Alan, we can't publish exact transmission sites for every positive case. I know everybody would love that. I would love it too, because it would allow us to target the interventions much more accurately. That data is simply impossible to get because of the incubation period of the virus. Everybody gets symptoms 7 to 10 days after they get the virus. You cannot tell where they caught it, except in exceptional circumstances where it's very specifically an outbreak, where it's obvious that that's where they met the positive case, perhaps in their house, perhaps in their workplace. But gym outbreaks are happening. They have happened around the world and around the UK. They are unusual and rare because the mitigation is really, really good. And that's why they're allowed to open at level 3, where a lot of things aren't. So I think we've got them at exactly the right point.
Thanks, Jason. If I can now turn to Neil Pooran of PA. Neil.
Thanks, Deputy First Minister. Again, on the issue of the higher and advanced higher exams, in terms of when you expect to be able to make your decision on whether they go ahead or not, are you hopeful you'll be able to do that before the Christmas break? And also, there's been some concern that schools in more deprived areas are being more affected by absences during the pandemic than other schools. Is that the kind of inequality issue that you'll be weighing up when you make the decision?
That last point is very much in my mind, Neil. I have to be satisfied on the issue of equity in general, and there's a geographic element to equity. We've obviously seen the prevalence of the virus being more intense in some parts of the country than it has been in others, and we have to take account of that experience between different parts of the country to be satisfied that no young person is essentially put into an equitable position because of their geography. But then there is some further detail within that, which is that the level of disruption to the education of young people caused by self-isolation has tended to be greater in areas of deprivation. And I'm particularly anxious, given all of the focus of the government on closing the poverty-related attainment gap, of supporting young people to use the power of education to be able to emerge out of poverty and to have a higher quality of life, that we make sure that we support young people in these circumstances. So that factor weighs very heavily in my judgments, and as I said in my answer earlier on, I'm looking very closely at the feedback that is coming to me and the data that's coming to me from schools and from local authorities around the country to come to that judgment. In terms of timing, as I said earlier, I don't want to leave this decision to February. We will come to as early a conclusion as we can be. Inevitably, this decision is a product of observing just how much disruption there has been to the education of young people and making a sensible assessment of what is the most appropriate step to take to make sure that every young person has got an equal opportunity to make the progress to which they are entitled to make based on their ability. So I can assure members of the public and members of the teaching profession and young people on this question. Indeed, I'll be having discussions with young people later on this afternoon on this very question, is that I will take that decision at the earliest possible opportunity that I'm convinced that there is a need for us to take such a decision. Okay, thanks very much. We'll move on to Dan Vevers. Dan, of The Sun.
Thank you. Good afternoon to you both. Last week, the Fraser Vallender Institute said up to 1 billion of 8.2 billion COVID money the Scottish Government has received from the UK Government could be unspent. Were you saving this money to make the announcements we heard at SNP conference? And does this, in the way the First Minister insisted independence was needed for the recovery, and the way you picked a fight with the UK Government over the £500 bonus, does this all show that you're now playing politics with the pandemic? And secondly, if I may, when is the target date, or even just a target month, for having vaccinated all Scottish adults? Presumably you must have one, even if it's just provisional.
Thanks, Dan. The first point is, my blunt answer is no. We have resources available to us that are announced by the Finance Secretary. She takes decisions based on the justifiable use of public expenditure for a variety of different issues. And of course, we have put in place substantial support to individual businesses around the country, and indeed have recently announced more support for businesses to support employment. The £100 child payment, which we have approved as well, is a very important support to families who are facing difficulties in these circumstances. The money that was allocated, for example, to make sure that we were able to provide for free school meals for young people who were eligible through the October and the Christmas holidays, and through the Easter holidays as well. These are important commitments that we have made and illustrate that we are taking appropriate and rational decisions based on the money available to us to support individuals and organisations that need that support. And the Government will continue to do that. In relation to the rollout of the vaccine, Professor Leitch went through a number of the factors that we have to bear in mind in the rollout of that vaccination. We're dependent on sufficient volumes of the vaccination coming forward. So that's a very significant factor in the judgment about what will be the ideal timing. What I would say is that we want to advance with the vaccination programme as quickly and as swiftly as we possibly can do. Huge resources have been allocated to make sure this can be done in an accessible way in all parts of the country, and we want to get through that vaccination programme as quickly as we possibly can do. But I think members of the public will understand that we are dependent on the volumes of vaccine coming to us. And also, of course, we've heard and we've talked a lot this week about the Pfizer vaccine. There will, of course, be other vaccines emerging as well, and we will be working hard to make sure we can get access to those supplies to help us in that effort as quickly as possible. I don't know if you want to add anything to what I said.
It seems to me that if we give you a season, you ask for a month. If we give you a month, you ask for a specific week. There are just too many unknowns. We don't know which vaccines will be authorised. We don't know how many of each vaccine we'll get. We know how many we've bought, so 100 million doses across the UK of the AstraZeneca vaccine. So the AstraZeneca vaccine is very important to us. If that gets approved soon rather than later, that helps us. It brings everything forward a little bit. What we've said across the whole UK is that we're hoping to get to that over 50s group by the summer, and that would allow us to remove 99% of the mortality of this disease. If everything goes well and you get everybody vaccinated who's over 50 and those with pre-existing conditions under 50, then you get to 99% of the mortality, which is why the question around teacher vaccine is quite important, because the JCVI have told us concentrate on age, not job. And that's where you get the biggest bang for your buck. So every injection counts in that process. So get the oldest first and bring that downwards. And the only exception to that profession rule is health and social care workers who are meeting actual COVID positive patients at the front line. So that's why we can't tell you exactly when, but we can tell you it will be just as quick as the vaccine arrives.
Thanks, Jason. Can we now go to Scott McNabb of the Scotsman? Scott.
Thank you, Deputy First Minister. Just following up on that, the comments you made earlier on the 99% of preventable mortality. Maybe it's for Professor Leitch, but I'm wondering if you can set out the likely impact that will have on the NHS, given the real big danger, which was always highlighted in this pandemic, was that the NHS may be overwhelmed.
Let me say a little bit about this before I pass over to Jason Leitch. Obviously, the issue of the capacity of the National Health Service is an issue that is uppermost in the thinking of ministers in the planning that we have undertaken for the handling of the pandemic. We have a particular challenge over the course of the next 3 months, where we will still have COVID with us in a significant presence, as we see from the data. But then we will also have, in January and February, the 2 months of the most significant winter pressures on the National Health Service. So the decisions that ministers are taking about, for example, the application of restrictions, and particularly the decision that we took a couple of weeks ago to place a number of areas into level 4 restrictions, were about decisions assessing essentially the prospects around COVID and capacity of the National Health Service over about a 3-month period into late February, early March. So what we wanted to do was to get the levels of COVID in the community significantly reduced before we went into the Christmas holidays, so that we were able to cope with the degree of interaction that will take place over Christmas, but then also to make sure the health service was able to cope during a period of intense pressure, which will be the case in the first 2 months of 2021. So that medium-term planning by the government has been central to the decision-making that ministers have taken. And then obviously the emergence of the vaccine, as it begins to gather momentum during December and January, will assist us in reducing the scale of the COVID presence that is likely to be presenting itself in our hospitals, and therefore ease the pressure that's on the National Health Service at a particularly demanding time.
I think that's about it, Deputy First Minister. So very, very gradually, this will help with pressures on the National Health Service. If you have this vaccine, you are about 90% less likely to catch COVID or to be ill from COVID, and then to be seriously ill from COVID. If you're particularly in that high-risk group, that would stop an admission to hospital, it would stop an intensive care admission. But let's remember, next week we're going to vaccinate only very few people because we simply don't have the volume of the vaccine. So as we do that into the first few months of next year, that will gradually reduce the pressure that we have modelled into the health service. However, it's very important to realise that winter is hard without COVID. Winter is difficult in the health service, and I've worked in that winter period in the health service for many, many years, not anymore, fortunately for them. But it's a very difficult period in January and February with respiratory illness, with trips and falls, with everything else that goes on in the weather. So COVID isn't our only problem, but gradually reducing the COVID infection rate will help with admissions.
Thanks, Jason. We'll now go on to Derek Healy from the Courier. Derek.
Thank you, Deputy First Minister. Can you confirm how many vaccine centres have been identified as of today, and how many will ultimately be needed to carry out the full vaccination programme? And I also wanted to ask you about people who are potentially in the shielding group or were in the shielding group or very unwell. For people with maybe terminal conditions, obviously getting the vaccine could free up their lives in a very meaningful way. Has any consideration been given to that at this stage?
Well, I'll say a little bit about that second point first, Derek, and then I'll ask Jason to go through the detail on the vaccination delivery. Obviously, in the key judgment we've made on the delivery of the vaccine has been to follow the independent advice that we've had from the JCVI, the Joint Committee on Vaccines and Immunisation. And in their advice, they indicate that the first group that should be given the vaccine are residents in care homes for older adults and their carers. And then it essentially moves down through the general population, those aged 80 years and over, frontline health and social care workers, those aged 75 and over, those aged 70 and over, and in that category also the clinically extremely vulnerable. So there will be judgments made to directly answer your question about some people who will be on the shielding list, where extreme clinical vulnerability is the test that is applied. So there's obviously a judgment which has got to be made here about the distribution of the vaccine based fundamentally on how much we can use the vaccine to suppress the exposure to serious illness that members of the public have. And we know that age is a particular vulnerability to the virus, hence the priority being given to elderly residents in care homes and those over the age of 80, and also health and social care workers who are right in proximity with the virus on a daily basis. So I think it's correct that we follow that advice, and of course in some circumstances that will address directly the clinically extremely vulnerable who are part and parcel of the prioritisation list that's been set out by the JCVI. Jason.
Yeah, so the biggest risk by a mile, we've said it many times from here, is age, irrespective of disease, which is why you start with the oldest. And as you work down, the JCVI have added in that vulnerable group into one of those levels. They've chosen to put that in with the over 70s, and that's about the right place depending on the risk. And we will, of course, follow that list in order as we get vaccine supply. One just slight correction, Derek. The vaccine does not free up individuals to behave in any different way yet. That may come, but for now, if you are vaccinated, you behave the same as the rest of the population. We do not know yet what the vaccine does for transmission risk, so therefore all other restrictions stay in place, even for the vaccinated. As to the centres, that will evolve over time. We have very little vaccine coming this week, in reality, and that will be done around the big freezers that we've got for security reasons. We're not going to list exactly where they are, how many there are. We know we've got over 20 of those really big freezers that keep this at the level it has to be at. They are distributed around the country, and we will be able to use them around the whole geography of Scotland. As the vaccine programme gets up and running into the new year, as we get more vaccine, that's when you'll start to see max vaccination centres. That's when you might see us using community centres or football stadia or GP practices. All of that will come in a wave further on than now.
Okay, thanks very much, Jason. We'll move on to Tom Martin of the Daily Express. Tom.
Hi, good afternoon. Thank you, Deputy First Minister. It's actually a point Professor Leitch just touched upon there, the security reasons in keeping, the location of these sites under wraps. And I know the Health Secretary touched upon it in her statement yesterday, saying MI5 had advised against disclosure of where these places are. Can I just check, though, just to make sure you're not aware of any specific threat being made around deployment of the vaccine at this stage? And on a wider point, just what assurance you can give the public in terms of security?
Well, there's no direct intelligence on this question, Tom, but there is what I would describe as wise advice from the security services about the significance and the importance of the virus. The virus is a very, very attractive commodity, and attractive commodities attract sometimes unhealthy interest. So the security services are giving us that advice. The government welcomes that advice and we will follow it. And I think members of the public will understand why that's the case. And what will go with that will also be the appropriate security arrangements to make sure that we can be able to faithfully assure the public that when the vaccine comes to Scotland, we will be able to handle it properly, it will be handled securely, it will be distributed securely, so that we can maximise the supply of the vaccine to members of the public within Scotland. And that's the rationale for the advice, and we'll be following it to the letter. OK, if we can move on to Alistair Grant of the Herald. Alistair.
Hi there, thanks very much. I wondered if you could respond to some of the criticism from teaching unions yesterday following the decision not to extend the school Christmas holidays. The EIS said that they had asked the schools move to remote learning in the final week. I think Larry Flanagan, the General Secretary, said it would appear that this is yet another political decision by the Scottish Government which may thank teachers but is unwilling to listen to them. And the Scottish Secondary Teachers Association said the decision was a kick in the teeth. Just looking for your response to that criticism. Can I also just double check, and I appreciate what Professor Leitch was saying a couple of minutes ago, that this is completely up in the air, but just so that I understand, is a position that under 50s who are not in at-risk health categories, that they should expect to be receiving vaccinations by the summer?
Okay, let me come on to the first point that you've raised, Alistair, about the points from the teaching trade unions. I think it's pretty obvious, and from the comments that I've made throughout the pandemic, indeed from the comments that I have made and the actions I've taken throughout my tenure as Education Secretary that I value enormously the contribution made by teachers to the education of children and young people. I've supported that. I have encouraged the development of the teaching profession to continue to deliver the excellent standards that are delivered in our schools around about the country, and that's been very much to the fore during the pandemic as a consequence of the challenges that teachers have faced in the delivery of education in these most extraordinary conditions, and that has been achieved given that we returned our schools to full-time operation earlier than any other part of the United Kingdom, and we've been able to sustain that throughout the terms since August. Now, the judgment here is based entirely on public health advice, and I published yesterday the public health advice that I have received on this question, which comes down to, I think, one critical point, which is that we can minimise the transmission of the virus between young people if they are in an organised environment like a school, as opposed to being in home or community settings. So to essentially tip the balance and to put more young people into a community setting would be to go against that public health advice. So there's no politics involved in this. It's public health advice that I am following. Now, of course, in some parts of the country, based on local authority decision making, schools will stop for the Christmas holidays on the 18th of December. Some will stop on the Monday the following week, on the 21st. Some will finish on the 22nd, the Tuesday, and some in the locality that I represent and live in will close on the 23rd. Now, obviously, I appreciate that some of those closing dates are getting quite close to Christmas Day. And there are concerns which the teaching unions have given to us about the possibility that teachers and particularly school leaders may be involved in contact tracing work on cases that may have emerged within individual schools. Now, what we're doing is working with Public Health Scotland and the National Contact Tracing Centre to support local authorities in dealing with any issues of that type, so that those are not issues that have to be dealt with by school leaders, to make sure that all school leaders and all school staff and all school teachers can get the break to which they are entitled to over the festive season, and which I recognise they need, given how hard they've worked to keep education sustained for children and young people. And it's vital that we concentrate all our efforts on sustaining that education for children and young people. I'll ask Jason to deal with the second point.
What was the other question? I forget.
It's in relation to the eligibility. Well, let me deal with it.
Oh,
about,
I remember.
Yeah.
I've got it. It was the under 50s and the timetable for the under 50s. I got lost in the school answer. The fact is that that's the biggest unknown, because once we get to the under 50s, we're going to need big numbers of vaccine, and that's why you can't get us to say a month or a date. That group will have to be more patient. I would hope that would begin in the first half of next year. All of us would, but it will depend entirely on AstraZeneca, particularly getting us the vaccine. There are 200 vaccines in preparation. There are 3 in phase 3 trials. Many more vaccines will come along, and we're hopeful that will happen in the next few months. Remember again, though, that the 99% of the mortality happens in the 50s and up. And that's the groups we're going to vaccinate as fast as we possibly can, and then the general population. My final point is, remember, this vaccination will probably have to continue. We don't know yet when your immunity starts to fade or even disappear, so it may be this becomes something for our future, a bit like a flu vaccine or a travel vaccine, and we may have to have it regularly.
Okay, thanks very much, Jason. Dan Sanderson from the Daily Telegraph. Dan.
Thanks very much, Deputy First Minister. Just on the tier system in the run-up to Christmas, other than the 11 council areas, which we know obviously moving out of tier 4, how much hope can people in places like Edinburgh, which have seen lower virus rates, have that they might move down a tier? And also, just as we move out of Christmas, I think you've said it's inevitable we're going to see cases rise because of the relaxation of rules over the 5 days. So would it make sense to sort of preemptively hold areas in the same tier, or perhaps even move them up, given we know there's going to be a rise in cases, but that might not show through in the figures for a week or two, given what we know about how long that takes? Thanks.
Thanks, Dan. In one of my earlier answers, I talked about the perspective that ministers were taking over a longer time frame in making our judgments about levels. So in looking at the period from the beginning of December, for example, right through to the end of February, we've got to look at, first of all, the prevalence of the virus at that point in early December, the social interaction that will take place at Christmas, and then the inevitable pressures on the National Health Service in January and February. So we've taken some decisions in the run-up to the early part of December, which have been designed to essentially suppress the virus as low as we possibly can do to essentially lower the prevalence of the virus before we get into more challenging territory in deeper winter time. Now, we are seeing the fruits of that, because if you look, for example, at the cases per 100,000 on average in Scotland, about a fortnight ago, they were sitting at about 140. On the data that's most recently available, they're sitting just a little bit above 100. So there's been around about a 28-30% reduction in the average number of cases across Scotland as a consequence of the measures that we have taken already. And that's been quite deliberate to essentially push down the prevalence of the virus with restrictions which I totally accept are unwelcome in large parts of the country, but they have been designed to help us to navigate our way through what's going to be a really challenging period. When it comes to the judgments about levels, as I said earlier on, over the weekend, our officials are today engaged in discussions with local authorities about the case numbers in individual local authority areas. Over the weekend, I will be involved, as will the Community Secretary, Aileen Campbell, in a number of discussions with local authorities to hear their views. We listen intently to the perspectives in local authorities. Earlier on this week, I listened carefully to the perspectives of Aberdeen City and Aberdeen Shire, and on the basis of the evidence available to us and the evidence that they presented to us, we judged that it was not the correct moment to increase them from level 2 to level 3. So the dialogue is valuable and significant, but we obviously have to take judgments based on how we will be able to work our way through what's going to be a very challenging period, and that will be the substance of the decisions that Cabinet will take on Tuesday morning, and which the First Minister will set out to Parliament on Tuesday afternoon. And within that, there may well be decisions where some authorities are going up and some authorities are going down, but we'll confirm those decisions to Parliament on Tuesday afternoon. Okay, we'll move on now to Kenny McBride of Broadcasting Scotland. Kenny.
Deputy First Minister, when setting up the mass testing sites in Johnston and elsewhere, was any consideration given to doing antigen testing at the same time? If so, could you tell if it was considered, could you tell us a bit about that decision? If not, why not? And what value does antigen testing have at this stage in the pandemic?
I'll ask Jason to deal with that.
You mean antibody testing, do you?
Antibody, sorry, yes.
So we are doing antigen testing, to be clear. We're looking for DNA of the virus. That's what's happening in Johnston. Antibody testing is done across Scotland at a surveillance level. It's much more invasive. You need blood for antibody testing. You can't do it from mucus or saliva. You have to take blood samples, so it requires healthcare trained staff. It's a whole different thing. It's much longer, it's much more invasive. So that's why we do it just now on a research basis and a surveillance basis. And it teaches us really only one thing. It teaches us who has had the virus within a period that's still a little bit indistinguishable, because we don't know how long that immunity lasts, how long those antibodies last. So for now, across most of the world, in fact, being used as a surveillance exercise and principally, particularly now with vaccines, as a research exercise to help us understand the immunity. That's why we don't do it at a large population level.
Thanks, Jason. And our final question for today is from Greg Russell from The National. Greg. I think we're having a job connecting with Greg. Right, okay. We can't reach Greg just now, so sorry about that, Greg. Can I just then draw our briefing to a close today? Can I thank you for your attention today and your interest in the information that we've conveyed today. Can I encourage everyone to follow the rules that we've set out, the guidance that's in place, that people should wear face coverings, avoid crowded places, clean your hands and clean hard surfaces, keep 2 metres distance from people from other households, and self-isolate and get tested immediately if you have any symptoms of COVID. Can I encourage people who haven't done so already to download the Protect Scotland app? It's a really important and valuable tool in all of our efforts. Can I thank Rachel, our BSL interpreter, for her support again today, which is very much valued by us all, and thank Professor Jason Leitch. Can I wish everyone a very safe and happy weekend, and we'll convey further information on Monday at the briefing next week. Thank you very much.